Phase 2b program with sonlicromanol in patients with primary mitochondrial disease due to the mitochondrial DNA 3243A-G mutation. This study demonstrated that sonlicromanol was well tolerated, showed a favorable safety profile and was efficacious in more severely affected patients. Long-term treatment, up to 52 weeks, with sonlicromanol showed more pronounced changes from baseline without showing clinical relevant QTc prolongation. This variant of the mitochondrial MTTL1 gene is the most common genetic defect causing primary mitochondrial disease, with a prevalence of 3.5 per 100,000 live births. The challenges faced by patients with primary mitochondrial disease due to this mutation, among others, are muscle weakness, chronic fatigue, pain, and cognitive decline. This may lead to social, emotional, and economic impairment of different aspects of the daily functioning of these patients. This variant of the MTTL1 gene is associated with tRNA and causes mitochondrial translation defect leading to isolated or combined complex 1 oxidative phosphorylation deficiency and subsequently hampers oxidative phosphorylation. This defect alters the cellular redox status and triggers inflammatory responses. Primary mitochondrial disease is a group of rare conditions, with no approved treatment to date, except for Leber hereditary optic neuropathy. Thus, there was an urgent need for the therapeutic options to alleviate the symptoms of this disease. Sonlicromanol is a promising candidate, as it positively alters the key metabolic and inflammatory pathways associated with primary mitochondrial disease. It is a chromanol piperidine that shows improvement in the cellular redox status. It activates the thioredoxin system, peroxyredoxin enzyme machinery, and attenuates the induced lipid peroxidation, thereby preventing ferroptosis. Further, it selectively inhibits the microsomal prostaglandin synthase E1-mediated PGE2 biosynthesis and attenuates inflammation. The objectives of this study include to assess the effect of sonlicromanol on neurological, behavioral, and quality of life symptoms in patients with primary mitochondrial disease due to this mutation, and to report the results of the Phase 2b program consisting of safety, tolerability, and efficacy of sonlicromanol. The main inclusion criteria were patients with confirmed mitochondrial DNA tRNA mutation, with positive NMDAS score of more than 10 at screening, and male and female aged greater than or equal to 18 years were included in this study. The patients were randomized and 27 patients were treated with sonlicromanol 50 mg, 100 mg, and placebo for 28 days. Further, in the extension phase, 12 patients were treated with sonlicromanol 100 mg for 52 weeks. The primary endpoint include the change from placebo in the Cogstate Identification Task Test. Further, the secondary endpoints include additional Cogstate tests, TAP, with and without alarm, BDI, SF12, NQF, CFQ, headache, smell, hearing. In addition to the RCT efficacy outcome measures, more endpoints are included in the extension phase, which include 5-time sit-to-stand test, mini-BIS test, SFMPQ, for pain, and SF36 questionnaire, EQ, 5D5L for quality of life assessments, most bothersome symptom assessment, patient and clinician impression of change. The safety assessments included the monitoring of adverse events, safety laboratory tests, vital sign measurements, 12-lead electrocardiograms, thyroid sonography, and physical examination findings. Significant improvements were observed in attention performance, symptoms of depression, and cognition among the patients in the RCT phase. In the extension phase, significant improvements were noted in attention performance, symptoms of depression, pain, physical performance, and quality of life among these patients. Results provided insights for the endpoint selection in a larger 52 weeks Phase 3 RCT study in more severely affected patients. With these results, we have importantly de-risked the upcoming Phase 3 trial. Find more specialized content on our portal.